Module Overview. This module provides individuals, especially international and newly relocating healthcare professionals, with a deep understanding of how the National Health Service, NHS, in the UK and other European public health systems classify roles, responsibilities, and pay structures through standardized banding systems and job descriptions. This knowledge is not only crucial for interview preparation, but also for negotiating fair wages, understanding hierarchical growth opportunities, and aligning your experience with relevant job postings. Interviews in the NHS and EU institutions often test your awareness of the structure, expectations, and responsibilities tied to the role's band or grade. This module is built to prepare you for confident interviews for banded roles, strategic job targeting aligned with qualifications, transparent salary expectations, alignment with CPD continuing professional development pathways. Section 1. What is NHS banding? The NHS Agenda for Change, AFC, defines how most NHS staff are paid. Each role is classified from Band 1 to Band 9, depending on responsibility, skills, and qualifications. Band typical roles: starting salary, 2,024 ST, 2 healthcare assistant, porter, 22,000 to 24,000 3 senior HCA, therapy assistant, £24,000 to £26,000, 4 assistant practitioner, admin lead, £26,000 to £28,000, 5 staff nurse, radiographer, paramedic, £28,000 to £34,000, 6 specialist nurse, senior therapist, £35,000 to £42,000, 7 advanced nurse practitioner, ward manager £43,000 to £50,000, 8 A to D, senior managers, consultants, heads £50,000 to £78,000, plus 9 executive roles, £95,000 to £110,000, plus the band number reflects not just salary, but the complexity and responsibility of the role. Section 2. Reading and interpreting NHS job descriptions. Every NHS job comes with a person, specification, minimum qualifications, skills, knowledge required, a job description, duties, responsibilities, hours, and reporting structure. During interviews, you may be asked, can you give an example of how you meet the requirements outlined in the person specification? Key components: knowledge and qualifications, communication and interpersonal skills, analytical and planning skills, experience values aligned with NHS Constitution. Tips: study job specs before applying. Use STAR responses to align your answers with the competencies listed. Prepare role-specific examples that demonstrate leadership, empathy, autonomy, and decision-making, depending on the band level. Section 3. Band expectations versus responsibilities. Band expected level of independence: interview focus 2 to 3, high supervision, support role, basic tasks, communication 4 to 5, some autonomy, clinical judgment, initiative 6 to 7, independent decision-making, leadership, managing others. 8 to 9, strategic vision and governance, innovation, systems leadership, common interview. Mistake: applying for a Band 6 post but answering with Band 5 level responses. Task-based, not strategic. Section 4. Understanding pay grades across EU healthcare. In countries like Ireland, Germany, and Sweden, job levels are classified under civil service or public healthcare pay scales. Ireland, HSE, uses grade levels, e.g., grade 5, admin, or staff nurse. Entry salary, €30,000 to €35,000, pay rises with years of service and CPD progression. Germany, hospital roles fall under TVÖD system, Tarifvertrag für den öffentlichen Dienst. Example, P8 level for nurses, E13 for medical researchers. Sweden, healthcare salaries are negotiated through union agreements, clear transparency in pay per role and region. Interviewers across the EU might ask, are you aware of the band or grade applicable to this role? Section 5. Using banding info to prepare for interviews. Your preparation must include matching your CV and cover letter language to the role's banding, preparing evidence-based answers, e.g. audits, clinical governance, training others for higher bands, demonstrating awareness of NHS Constitution values like respect and dignity, compassion, improving lives. Section 6, Standards and Accreditation Alignment. This module complies with NHS Employers Agenda for Change, AFC, Pay System Health Education England, Banding Expectations Framework, NHS Leadership Academy, Professional Behaviours by Banned European Commission, Cross-Border Professional Mobility Framework, World Health Organization, Health Workforce Development Strategy, UKCPD Certification Standards Office. Summary. Module 7 prepares healthcare job seekers to understand the structural framework of healthcare roles, match their professional background to appropriate bands/grades, strategically communicate their competency level at interviews, navigate job markets across the UK and EU with clarity and confidence,